On this edition of Thursday Tips with Dr. Hustak, I wanted to touch base on NeoGraft or hair transplanting. There are a couple different devices on the market, and of course there's the traditional way of harvesting grafts by hand that we wanted to talk about. But we have at ACPS is the NeoGraft machine. And essentially what this is a scarless technique for harvesting of your follicular units and then retransplanting them into your anterior hairline or into your vertex or top of your head. Male and females can both benefit from hair transplant. There are a plethora of reasons why you might lose your hair, but of course the traditional patterns of male pattern baldness are the most common reason that patients mostly see us. And a common question we get is, where do you take the cells and where do you put them? Traditionally, we take them from the back of your head. That is where they are the most hardy and the most resistant to hormone changes, particularly DHT, which is the derivative of testosterone. And that's why most men go bald anteriorly and at their vertex. And so this follicles back here, if you see men that have balded over the years, they will always have this posterior hairline, and that's because those follicles are much more resistant. They don't have that same receptor there. And so by harvesting these back here, the old way was to make a scar. So we would make an incision and take a swath of tissue, take it onto the back table and take out each follicular unit and retransplant it. Now we have a device called NeoGraft that uses a machine to make a small punch hole around each follicular unit and extract that. And it's not every one, of course, because you get a bald spot back here, but it's scattered throughout the back of the head, so that way we can do it in a very natural way. Without scars, and when your hair regrows, you don't even know it was really borrowed. And then we take those units, we put them on the back table, and we sort them. There can be between 1 to 4 hair follicles per unit, and we transfer those. A general rule is that you have about 2,500 per your palm, or about a CD's worth. I know nobody has CDs these days, but that's a rough estimate. And so that'll kind of give you an idea of how many grafts that you need. In one sitting, usually we stay around 3,000 or less, just because it takes some time. You'll be there for a solid half day in order to transplant all those. And after we harvest them and get you good and numb, and while we're sorting them, we come up to your hairline and we draw exactly where we're planning to put these grafts. And a very natural hairline. And so for most men, we would go around the front part and then into your widow's peak in a very natural way. And this will kind of be drawn on with the help of you to see where you really want these follicular units. Sometimes we'll go back more to really mimic that natural recession depending on your age. And then in the back, we also fill those in oftentimes to give you a very natural frontal hairline. You can have a second session, and some people do as long as you have enough donors. But most people only require one treatment, which is fantastic. This is a permanent result. These follicles are going to continue to age, but they'll have the memory of where you harvested from. And so this is essentially a one and done type of procedure. It is costly, of course, but because of its permanence, I think most patients are incredibly satisfied that they did it when they did. If you're somebody that just is trying to camouflage a scar, we do this oftentimes with old coronal lifts, lateral subcutaneous brow lifts, or even old facelifts where we need to camouflage scars, even traumatic scars. You can graft in a votive candle. The base of it is about 300 grafts, so most scar can camouflage with 300 grafts. If you're doing just frontal hairline, sometimes you can get away with around 750 grafts. And so as a rough estimate, all of those things will help you decide whether or not you're a good candidate for one, and whether or not we can get what your desired effect is with donor follicles and how many you may need to get to your results, and whether or not 1 or 2 sessions are needed. So we do offer NeoGraft. We love it. It's a very popular procedure. Come visit with us today to see if you're a good candidate for it.